So welcome everyone. We are here doing another segment as part of the COVID reopening of practices that public education from WPA had started with a conversation between myself, Ben Rader, and Mike Zussman. And I'm here today with Karen Gust-Brey, who's a psychologist with the Department of Health Services, specifically at Mendota Mental Health Institute. And we wanted to kind of get a perspective from a different area of practice and a different setting than what we had talked about prior. And we thought Karen would be a great person to talk to us about the Department of Health Services and how things either have changed or didn't really change a whole lot for them with the COVID pandemic and now sort of reopening. So Karen, if you want to kind of just tell us, how did COVID impact you guys, if at all? And then what are some of the outcomes you've seen from COVID on how you practice psychology in your setting?
Great. Thank you for the time to kind of talk to you about this. So for us at Mendota, we were unable to shut down because we're a 24/7 institution and we had to continue on seeing patients who are court-ordered for our services. So what we had to do is we had to figure out how to best continue what we were doing and be able to not only keep ourselves safe, but especially our clients and other staff safe. So we had a lot of early struggles in navigating like the PPE situation, but eventually we were able to set on a particular format and way that we would try to do our work, therapy and evaluations using PPE. But that was a struggle when you have to evaluate people and see how they are interacting with you and if are they exhibiting symptoms of mental illness. You know, if we have to wear a mask and they have to wear a mask, you can't always see if somebody's talking to themselves or what their facial expressions are. So we had to learn how to adapt to that. We've also with having to stay open and continue services in person throughout the pandemic, we found that many people who would be served in the community just could not be served in the community. And so sometimes we would be doing an evaluation for the purposes of court because people in the community working as psychologists were unable to do testing because they were doing virtual testing. And so an inpatient evaluation would be ordered to include testing, but we had to somehow figure out how we were going to test somebody inpatient while maintaining social distance and trying to be safe for ourselves, other staff, and of course our patients. So, this quite honestly created a lot of stress for us in the early portion of the pandemic. And I think that psychologists in settings like ours, we had to figure out can we best support each other through this situation. I also think that it just really increased the number of patients we've had to see and put on stressors in the system in that way, because we're seeing patients that couldn't access services in the community for periods of time and then got very low level charges in the community, criminal charges, and competency was raised. And now we're seeing a lot of patients coming in on misdemeanor charges, and we have limited time to try to do treatment with them. And so, I think there's been a lot of challenges to that, to institutions. And I guess I wanted to just share the perspective because not all psychologists had the ability to work through telehealth.
Yeah. And I like the point that you also raise about just the toll that likely had on all the psychology and mental health staff working in these settings, because, early on in the pandemic, we didn't know, we knew the basics about COVID and what we were hearing from the news media, but we didn't necessarily know as much as we obviously know now. And I would guess that there was a good amount of fear and a lot of scared folks going, how do we have to go and meet with these people face to face? And what are we going to do to stay safe?
Yes. Yeah. There was a lot of that in the beginning because our staff, come from all different walks of life, and some, just had come back from maternity leave, and some, had been here for quite a while during retirement. And you think about like our life, and we have family and outside of work that we have to have a concern about it, because what we do is we see people who come from all over Wisconsin. They don't just come from the Madison area, and they're coming from high risk areas, jails, into our institution.
Yeah.
And so there was a lot of fear. And I think in psychology, we had to learn how to support ourselves, but we probably could have done a lot of things differently in that, because there were some people who decided this wasn't the environment for them. On the flip side, there were staff who thought this was the environment for them because there was stability in our jobs. We didn't have to worry about like outpatient people, how they were going to navigate stuff because we still had work to go to.
Yep.
So,
yeah.
Yeah.
Well, Karen, I thank you very much for the time to talk today a little bit about this different perspective, and then for an environment where you didn't have the option to shut things down or go virtual. So we really appreciate the time, and hope you have a good rest of the day.
Thank you very much.
All day.